Well, thank you for coming. I'm Senator Chris Eaton, and along with Senator Julie Rosen, who is the chief author of Senate File 730, and Representative Dave Baker, who is authoring the House bill, which is 1440. We are trying to do something about the opioid epidemic. The pharmaceutical companies knew what they were doing. They knew that these medications were addictive, although they told the doctors they were safe with the extended release, et cetera. And so we have an epidemic on our hands. We have people dying. We had more people die in the United States last year from opioid overdose than we did from the Vietnam War. We lost 400 people in Minnesota last year. Another 2,000 overdosed. It cost Hennepin County $16,000. $16 million, thank you. It's still so amazing to me that it's $16 million. But anyway, so this bill should raise hopefully close to $20 million a year, which sounds like a lot of money till you look at Hennepin County, which cost them over $16 million. So I will start today, I will start with introducing our first speaker, Mr. Joseph Ranazizi, who was the former DEA director.
Thank you, Senator. My name is Joe Ranazizi. I'm retired from the Drug Enforcement Administration, where I served the last 10 or 11 years of my tenure as Deputy Assistant Administrator of the Office of Diversion Control. Discussion of the opioid crisis is now front and center. It's a national epidemic and a national tragedy that continues to grow. The state of Minnesota is right in the middle of it. I mean, the deaths continue to rise. The deaths nationwide continue to rise. And there is a way to stop it, but it's a way that we all have to pitch in. We all have to be part of it. And certain segments can't sit on the sidelines and just watch. There are a lot of people in this room that have been touched by the tragedy. And it's not a tragedy that affects any particular demographic. It's not white, black, or Hispanic. It's not old or young, male or female. It's an everyone tragedy, and it's happening everywhere. I think we're all looking for solutions. In 29 years of law enforcement, because this is the worst epidemic that I have seen of all the epidemics, including meth and club drugs and synthetics, this was the worst, and it continues to grow. Okay, so what we need is solutions, and we need outside-the-box thinking, because outside-the-box thinking is key. I used to concentrate on demand. I never concentrated on resources, because resources just weren't my problem. Okay, but the states are bearing the burden of this problem. The states are bearing the financial burden of this problem, while the industry keeps making billions and billions of dollars, and that's why stewardship is so important. The industry knew what they were doing when they started this, and make no doubt about it, this was started by industry. And the idea that it's now a heroin or fentanyl problem is nonsense, because while heroin and fentanyl are hurting a lot of people, people generally don't start with heroin or fentanyl. They start with pharmaceuticals, where the problem started, pharmaceuticals. So if we try and handle heroin and fentanyl without handling the pharmaceuticals, we're just going to continue this cycle of tragedy. It's got to end. So it's all of us have to chip in. So there's 4 things that we could do right now. One is support this bipartisan bill to change a stewardship fee, to charge a stewardship fee. And it's about time. This is something that when I read about it, I was like, why didn't I think of that? It's brilliant. And it allows them not only to take accountability for what they did, but it also relieves the burden, the financial burden, on the state. It allows the state to recoup money, to put money where it needs to be, in education, in treatment, in helping families. I believe that all first responders and all people that are around the public should have access to naloxone, Narcan, naloxone, because we need to continue to save and rescue. I believe that we need to fight for additional resources for education. I think education is the key, and I'm talking about education of professionals and prescribers. They need to know what they're doing. They need to understand the opioid crisis. And while many doctors do, many doctors don't. And finally, I believe the federal government needs to be more transparent on resources. Resources are a key here, and we need federal funding. Okay? If all of this occurs, we're taking a great step towards at least solving the problem, or at least getting ahead of the problem. Okay? And to win this fight, okay, you have to show up. That means everybody. That includes the pharmaceutical industry, who right now have been sitting on the sidelines, not really showing up, providing excuses, but not providing any solutions, true solutions. And the way to start is to join in, help the cause, provide financial support to the states that need it. Thank you very much.
Thank you very much. For those who don't know me, my name is Dr. Chris Johnson. I'm on the board of the Steve Rumler Hope Network, and I'm here to basically support this bill and its notion of industry accountability, because we're dealing with a crisis that even on the low end has killed about 250,000 Americans in the last 15, 20 years, 250,000 people. And while other countries, other developed countries in Europe, Australia, are experiencing improved overall mortality of their populations, the United States is getting worse, and it's getting worse driven by opioid poisoning. This is unprecedented in the last 20 years in this country, that our life expectancies are getting shorter because of the medical profession. But that is the reality. I got involved in this process over 10 years ago, maybe 15 years ago, and I thought that when I first presented this information on what we were doing, there would be a radical change, but there wasn't. And the reason is there hasn't been good incentives to turn things around. And that's why stewardship and accountability has to happen. Because make no mistake, the industry caused this. There wasn't a grassroots patient movement to start increasing consumption of opioids by 500% all at once. This came because patients came to the medical profession. They said, we're hurting, and doctors, proceeding with the information they'd been given, said, well, these medicines are not nearly as dangerous as we thought they were. Here you go. We'll see you again in 3 months. Patients had no way of knowing that the claims about the effectiveness of these medicines hadn't been vetted at all. The longest study was 3 months. They trusted that it was a scientifically rigorous profession that would look out for their best interest because they took an oath. In my view, that oath was betrayed. Pharmaceutical industry had they weren't solely responsible, but they played a very key role. The medical profession, the medical industry is very complex. It involves the providers, it involves the pharmaceutical industry, the insurers, government, all are involved. And so all have to have a reckoning as to how could this have happened here in this country and nowhere else. And so while this bill does not address all of those factors, it starts to address a key one, which is we're going to make pharmaceutical companies help contribute to fix the harm that they've caused. And this is something we need to do. This is a systemic failure. And to fix it, we're going to need systemic solutions. That includes not just addressing the incentives in the pharmaceutical industry that could profit by billions by doing this. We have to address the incentives in the medical field that, how are you so vulnerable to doing this and putting patients in harm's way? And this also involves where our leaders are, our leaders being involved, because political leaders, legislators are involved in setting the marketplace rules for healthcare as well. And so everyone needs to be accountable. So I support this bill. It's a start, and one thing I do know for sure is that the patients didn't cause this, and the patients deserve better. Thanks very much.
Go ahead. Good morning. My name is Shelly Elkington. I am also a board member of the Steve Rumler Hope Network with Dr. Johnson, and I wish that I didn't have to be. I came to the network after I lost my daughter, Casey Jo, in 2015. She had been addicted to opioids after being prescribed them for a significant length of time. Most people know our story, but now it's time to talk about why this is important and why this bill is so important. I live in Montevideo. It's an extremely nice prairie community, under 5,000 residents in west central Minnesota. We had an overdose death there less than a week ago. The police chief from my community texts me on occasion and he'll tell me, "I've ran out of Narcan, can you get me more?" So this isn't a metro problem or just a rural problem. This is everywhere. Currently, our Montevideo is implementing an opioid response team in our hospital to get people who are struggling with opioids the help they need. This team-based approach will get them help by working with knowledgeable doctors and staff. The issue we're running into isn't that we don't have enough patients for the program or we don't have enough dedicated people to run it. It's that we don't have enough resources. I spent the last 2 weeks trying to find out how to get Rule 25 assessors in our community so that patients can get an assessment and get into treatment when they need to, not 3 weeks later. I also worked on trying to find where there are treatment bed openings, where the detox facilities are, places that accept patients taking Suboxone, finding naloxone and trainers in areas. It's nonstop, and it's frustrating to think we have the tools right here in this bill to provide that. And these pharma reps that were here today want to convince our good legislators that this fee will somehow break this state. I cannot fathom how that's remotely fair to put back on the people who are already paying for this epidemic. There's 400 and some people who died in Minnesota. Do you know that each death in this state costs taxpayers anywhere between $2,000 and $10,000? Police, fire, first responders, ambulance, ER, coroners, autopsy, investigations, court costs, jails, and burials. If anybody wants to convince you that taxpayers are suddenly going to have a burden after this bill, I can assure you they already have one. We are already paying for this. Do not let them project that this fee being assessed to them is going to now be passed on to consumers. It's one of the biggest, most selfish and misleading statements I have ever heard. This fee is being placed on manufacturers for pharmaceutical companies to raise their prices in order to continue to make billions. I'll say that again, billions, because I don't think people really can comprehend the number. Senator Eaton. Billions of dollars in profit. It should be illegal for them to raise prices on this. There should be a public outcry from all these legislators to every pharma lobbyist here that has promised that this is what's going to happen, that they won't stand for it. They won't stand for being threatened or intimidated. When they raised the price of EpiPens, what happened? It took an act of Congress to call them out on their greed, and we're not going to let them get away with those same threats here. They're threatening to make sick people pay for this when they are the ones who should be cleaning up the mess they created. When ExxonMobil spilled hundreds of thousands of gallons of oil into the Gulf, they were responsible for cleaning it up. Did your gas prices go up to compensate for that? Probably. Was it an option to leave the oil in the Gulf? No. They created the mess. They had to clean it up, and it's time that pharmaceutical companies clean up their mess. This burden has fallen on the public long enough, and we're tired of burying our children so they can have more money. It's sick, it's greed, and it's wrong. I testified earlier today, and I made a couple of statements, and one of them was this. When you bury a child, they ask you a lot of questions, don't they? They ask you what funeral home you want her to go to, if you want her to be cremated or buried. They ask you what clothes you want her in. They ask you what songs or scripture you want played at her funeral. But there is one thing they do not ask you. They do not ask you if you're a Democrat. They do not ask you if you're a Republican. And so I'm asking all the legislators in this building to not ask themselves that either. Senator Rosen last night said a statement that stuck with me. She said, "You know when it's time to do the right thing." And this is time to do the right thing because Minnesota make things right. We need to do this bill. We need to get money generated to provide resources. We are not Republicans or Democrats today, or when we talk about this bill, we are humans. We do this for Casey's life, for Dan's life, for Ariel's life, Dylan, Steve, Luke. I could read you names for the next 2 hours. This isn't oil spilled in the Gulf. These are lives, living, breathing people that were a part of our lives and aren't anymore. Thank you.
Good morning, I'm Julie Rosen. I'm Chair of Finance, and I'm the Senate author of the Stewardship Bill, and I'm very honored to work alongside Senator Eaton on this issue. And I'm starting my 16th year. When I first was elected, I was meth came into my Senate district and worked very hard in a bipartisan manner again on a terrible epidemic. And we are facing another terrible epidemic again. And I'm not sure how many more families are going to be affected by this, how many more deaths we have to witness. Fortunately, I have never had to experience that. I can't imagine what a parent or a family has to go through when losing a loved one. And it's happening over and over again, and I cannot believe the public outcry that is starting to swell. And so here at the Capitol, we have the Opioid Awareness Day, and it's time for all of us to step up to the plate. All of us legislators. I wake up every morning and I say, this is the best thing to do. Is it risky? Absolutely. Could I be hammered in my Senate district? No, because I know I am doing the right thing. I am bringing everybody at the table. Unfortunately, there is one big person that has not come to the table to offer a solution to this madness. And I would love to hear what they would like to say about this, but they haven't come to the table. All they say is, there's a threat, we may not sell in Minnesota. And I say, bring it on, because you will, there are billions of dollars at stake here. Be a part of the solution, pharmaceutical companies. Tell us what you can bring to the table. Because right now, all I'm hearing is that it's going to come out of the general fund. And as Chair of Finance, when that happens, somebody else is going to suffer besides the family or a loved one. It's going to be our mental health money, money to our children's. We could go on and on. So they should and better be part of the solution. And the other thing I said last night is that I'm just plain mad. I'm mad that it got to this point. So it's time to do something. It's their responsibility. They got us here, and they better be part of the solution. So thank you.